is CHAMPVA. And I like our discussion on this, Jason, because we are two opposite ends of the spectrum here. I personally don't use CHAMPVA.
Oh, yeah.
Jason does, right? And so CHAMPVA is time sensitive because it takes forever to go through. I think the last I heard was about 7 months was the average. I would probably assume, as a planning factor, I would just assume 9 months. And that is 9 months of possibly a gap in healthcare coverage for your family, which is a huge deal. I can tell you right now, if we didn't have health insurance, we'd be screwed. I'll tell you that. Okay.
Right.
So Jason, on CHAMPVA, because you use it, let's talk about CHAMPVA real quick.
So number one, my suggestion is if you qualify for CHAMPVA, apply for it and get it, period. Because if you have other insurance in place, it just becomes a secondary insurance for you, really, a supplemental, if you will. So that is the first thing. Then what happens is if you ever lose your primary insurance through whatever, Blue Cross or Kaiser or whatever it is, when that goes away in life, you already have established your CHAMPVA. Now, there is one thing you have to do. You have to call and say, hey, look, I don't have my primary anymore. We need to move CHAMPVA to the primary. Okay. And that's what I had to do for my my spouse and my son. Okay. So it was a supplement type of insurance, had another primary, got rid of that, and then moved that to the primary. Now, you might be asking yourself, well, what does it really cover? Right? I mean, it doesn't sound like it would be that great. Just by the name of it, it doesn't sound like it's just some,
VA
you know, it doesn't really ring like a full-fledged insurance. I mean, TRICARE barely even sounds like that, but whatever. TRICARE sounds more beneficial than CHAMPVA, right? And for CHAMPVA, you're not going to your VA doctor, for this. So the question now is, what sort of benefits are out there? Everything is the answer. I mean, it's inpatient, it's outpatient, it's your pharmaceuticals, all that stuff. It is ambulatory care. It is all the things that you would think of with it. Now, once you get to a certain age or requirements as far as Medicare, once you qualify for Medicare, you have to apply and get Medicare as well. And then what happens is it then slides back behind Medicare as a supplement to that. So there's some little things that you have to look at with regard to making sure that it's set up right, because you don't want to not have it. You definitely want to have it. So my suggestion is anytime you have something changing in your health insurance world for you and your family, make a call to the VA, CHAMPVA's phone number, make a call and ask them, hey, how is this going to impact me? Is there anything I need to do? I'm losing my other insurance. Now we just have CHAMPVA. Is there anything I need to do? Yes, there is. We need to move that to become the primary. Okay, thank you very much. We're now eligible for Medicare. Is there anything we need to do? Yes, you need to apply for, A and B. Okay, thank you. Right. So don't guess. Don't say you don't qualify for something. Make the phone call to the VA directly. They're great. They're great at the CHAMPVA phone number. It's not a long wait time like some other numbers. So is there anything you wanted to add, Clay?
Yeah, CHAMPVA, and people get this wrong all the time, and I want to be very clear here. Us as veterans, so for instance, Jason has CHAMPVA. Jason can't use CHAMPVA because Jason uses VA healthcare or another private insurance, which we know he doesn't have now. Jason's family uses CHAMPVA. That's what CHAMPVA is. It is actual health insurance, not for the veteran. So sorry, sucks to suck. Veterans have VA healthcare. CHAMPVA is for dependents, and I want to make that very, very clear. The only thing I'll add on CHAMPVA is recently, and it was this year, 2024, there was a big change to CHAMPVA coverage, which was an addition of, not taking away. And now they do telehealth appointments for like mental health and just all kinds of stuff. And it really catered to the rural areas that don't have access to, maybe in-network facilities. And so CHAMPVA has made a huge push on just telehealth appointments in general. And that's new as of this year. And so that would probably be the one thing I'd add. And one last thing too, because I just thought about it. If you get 100% P&T, because I'm thinking time sensitive, right? You do your state benefits, you call NailNet, you get that all figured out. The next thing you're going to do is decide if you need CHAMPVA. That's a decision you have to make with your family. It's not just, willy-nilly, I'm going to sign up for CHAMPVA. Definitely understand your situation. If you have a private or if you have a primary insurance, do you want a secondary? What does that cover? What's your health like? What's your family's health like? There's a billion little factors that go into that. And so, Jason and I, we're giving you the information. At the end of the day, you have to decide if CHAMPVA is for you. And if you make that decision, it's time sensitive because it's going to take 6 to 9 months to actually go through. And that's a really, really big deal. But that's all I have on CHAMPVA, Jason. Yeah, go ahead.
Yeah, I got a couple more things to just kind of bring it all the way around for folks. So CHAMPVA, right? As far as the things that they cover, I just pulled it up here just so I can rattle through them real quick. Inpatient and outpatient care, mental health care, prescription drugs, durable medical equipment, family planning and maternity care, hospice care, huge, right? None of us are getting any younger, right? Skilled nursing care, lab and radiology services. CHAMPVA does not cover 100% of cost. Enrollees are responsible for an annual deductible and their share of the allowable amount, which is usually 25%. Some services do not have a deductible. So it's just like an insurance plan. You got to read through it, understand it, look at it. CHAMPVA also offers a voluntary meds by mail service that delivers non-urgent maintenance medications to eligible beneficiaries. CHAMPVA does not cover, and again, that is a voluntary program. You can go to your grocery store and go get your meds if you want, like Clay does from Safeway. CHAMPVA does not cover long-term care or custodial care, which can be provided in nursing homes, assisted living facilities, adult daycare, or at a patient's home. So that's that little piece. Now, here's the you made me pull this up, Clay, because in the back of my mind, I was like, I don't know. So veterans can also have CHAMPVA. How? By becoming a dependent of another veteran. So if it's two veterans,
you got me there. You got me there.
Right?
Yeah.
So a veteran's spouse may be eligible for civilian health and medical program of the Department of Veterans Affairs, CHAMPVA, if they meet certain requirements. They are not eligible for TRICARE. They are the spouse of a veteran who is P&T, or they are a surviving spouse of a veteran who died from a service-connected disability, and another one would be they are the surviving spouse of a veteran who is permanently and totally disabled from a service-connected disability at the time of death. So I think that something else important to point out there is if you're the surviving spouse today, we'll just say a Vietnam veteran, for example, who died of a heart attack, you should be looking at DIC because they may have had ischemic heart disease, they may have had hypertension, which were a contributing cause to the death as the heart attack. So they should be looking at DIC, and then they should also be looking at CHAMPVA. So just to want to throw that out, and potentially Chapter 35 if they want to, go learn some underwater basket weaving. So there's definitely benefits out there that people just aren't aware of, and it's frustrating. So anyway, that was the last piece on CHAMPVA, Clay.